Well, hello everyone, and welcome to another edition of IPC's Vendor Advantage Network monthly spotlight videos. My name is Shannon Battle. I'm the Pharmacy Services Manager here at Independent Pharmacy Cooperative. And many of you may already recognize the face I have here with me from your most recent pharmacy conventions or any of your news feeds and social media. And for those of you who have not heard, Independent Pharmacy Cooperative, we have a new preferred vendor, UGO Rx, and AJ Mera is UGO Rx's co-founder. He's been a joy to work with the last few months, and I do thank you so much for being here with me today, AJ.
No, thank you so much.
Absolutely. Well, AJ, will you give our store owners just a high-level overview to start of what UGO really is?
Yeah, absolutely. So UGO is more or less a collection of experiences from over 1,000 pharmacies that we have in our community now, where we have built basically not just a community database for independents to search and learn to figure out drug coverage and what's working with various payer mixes, but also a in-depth Medicare Part D search tool. What we did is we got together with CMS and Medicare and took the entire Medicare Part D formulary and we programmed it into a search tool. To which about a few years ago, we also added FDA disease state search capability to allow our users to discover on and off-label covered items for any given healthcare plan. And really, the platform is solely designed around using data analytics to boost the profitability of the pharmacy, which I'm sure as many pharmacy owners out there know is a real pain in the neck to sit there and do. So we've tried to streamline that and use AI to really make that whole process seamless and executable.
It is. It's a lot depending on your PMS, where you have to go to pull, who can help you pull that information, and then how to read what you're pulling, put all that together.
Yeah, I think making sense of all of it is probably the most difficult element. My business partner and I, we were independent pharmacy owners ourselves in Los Angeles for, God, a little over a decade. And it's crazy how much is required of us as owners now than even was it 10 years ago. I kind of make this joke where, actors back in the day just had to be good actors, but now you've got to sing and dance. And I feel like, as an independent pharmacy owner, it's like you can't just be a great pharmacist anymore or a good pharmacy owner. You've got to be a marketer and you've got to be an entrepreneur and all these other things that are wrapped into that umbrella of being a pharmacy owner. And so, yeah, there's just a lot of dynamic shift that's happened.
It is. Well, that's perfect. I heard earlier this week you said that pharmacies can easily tell you what tools they use to process a prescription. But what tools are they using to actually manage the business of pharmacy? What does that mean to you? How is that different?
Yeah. So what we kind of meant by that is, when you ask a pharmacy owner, what are you using to process? They're going to probably rifle off their PMS system because it's what we know. It's what you're accustomed to doing. That's how we process scripts. But when you look at what they're using to manage the business, the real rough answer behind that is the majority of pharmacy owners are not managing the business because we're not really tracking things. And, we learned the hard way that the age-old adage of you can't manage what you don't track really, really, really comes into play. Now, I think the interesting aspect of this is, the PMSs have done a really great job of trying to give us access to information. But sometimes it's like water out of a fire hose, and something you touched on earlier, how to make sense of it becomes the difficult part. You're getting inundated with just Excel reports on Excel reports and, determining what is actionable, what actually means ROI and what means a big waste of time. Those are the things that I think we just never really learned along the way. And so for us, unfortunately, we had to learn it the hard way to the point where it almost cost us shutting our pharmacy down back in 2016. And it was really from that big time low that we went through that the concepts of UGO were really born. And we realized that it wasn't just us, obviously, going through these sorts of issues, that the pharmacy ecosystem as a whole is really getting battered. And pharmacy owners need something simplistic, something executable. Give us the cliff notes, just tell me what it is I need to do so I can go do it. And that's really what pushed our whole concept behind UGO.
That's exactly what I love about UGO. With IPC members and UGO now, both our GPO and our warehouse members are going to have access to the full suite of analytics that UGORx brings. So will you show us just a quick peek at some of the type of benefits on the platform that our members will be able to utilize?
Yeah, absolutely. Let me pull that up here. Awesome. So yeah, this is the UGO home screen. And basically what we've done is we've wanted to take the whole idea of data analytics and just make it executable with a low friction, high ROI mindset behind it. So, over the years, we've really learned that too much data really is not good. It can actually just create a numbness behind the whole aspect of it. So we spent the last 2 years really working on building an artificial intelligence back end to UGO, which is basically running concurrent analytics on the pharmacy for you. So one of the unique aspects of UGO is that it syncs up directly to your PMS system. And most PMS systems have what's called like an open API with us, where they will keep your data automatically uploaded into UGO every night for you. And our system takes that data, crunches it down, and looks for the lowest friction, highest ROI kind of analytic exercises you could do. And what we've done to simplify that is we've broken it down into a very simple workflow module here. So instead of inundating you with charts, graphs, and all that, which we do offer to the data nerds like myself out there, so don't worry, it's there. But we've taken it and broken it down into executable week over week action steps that what we call up here like technician and staff bubbles or ownership and management bubbles down here, either or can be jumped into and worked on a weekly basis. Because the one thing we learned over the years too is that there's a big difference between what's possible and what's feasible, right? The day-to-day of independent pharmacy ownership can change between walking in the door at 8 a.m. and having a big audit sitting on the fax machine from somebody or an employee not showing up. You make plans and they go right out the window by 8:15. So, we wanted to make sure that users could come in and simply click on something like a refill management audit, which may sound pretty basic, and some people might even say, oh, well, my PMS does that, but not quite in the way that UGO does it. We've looked into a system where we can come in and highlight and search for refill opportunities that not only may have been missed, but also circumstances like zero refill opportunities. Over the years, we learned that patients running out of refills opened a huge segment for us to not only make contact with a patient, touch base with them, but that doctors were very, very open to one-time fills in between patient visits and things of this nature. So users can come in and get a quick breakdown looking at when a refill was, supposed to be filled, what they profited on it at the time of fill, and then they can use the RX number to go cross-reference in their PMS, much like a very simple audit would take place. And once they've done it, they can just red X it out if they've completed it. Other things that we've also built into here are things like refill losses, where you could click in and the platform will say, hey, you process this prescription at a loss. It's coming due for refill, on the coming dates. And forgive me, this is demo data, so it's a little far behind. But it will say this is coming due for refill again. Now, obviously, if you lost money the first time, we want to get out ahead of it before the second time. And we allow you to do that by simply just clicking on RX numbers. And because UGO is the only platform in existence that is crowdsourced, this allows you to really bring in the whole element of the UGO community to say, hey, if I'm losing on something, is there potentially a more prudent NDC I might be able to use? Now, this comes directly from the UGO community. Or is there an alternative medication I can educate the prescriber or the patient about that might also be, more effective for that patient and covered under their insurance? So, you've got these various elements to what's affecting pharmacy profitability that we can jump into in a very kind of simple way. Now, from an ownership standpoint, we always like to make sure that we pay attention to what I like to call singles and doubles, to give you like a baseball analogy, where a user could come in here, click on their dashboard on high margin medications. Now, the funny thing is the word margin sometimes get misconstrued with the word profit or high dollar. And that's not always the case, right? You can't just go hanging out the back for unicorns. You want to look at what we call high ROI medications, meaning if I purchase something for $30 and I'm profiting 130, that's a great medication for the pharmacy from a business standpoint. How can we dive into increasing volume on these? Can I discover who the prescriber was? And all of that can be done by simply clicking on anything you see. And of course, all of this is backed by, training sessions that we offer unlimited access to with our users. We've got videos, we offer one-on-one training ability. We want to make sure that pharmacy owners and their staff are put in the best position to execute on what they see, which is one of the things that we felt most passionate about, because that's where we felt kind of left at the altar during our difficult points of ownership, is that we had a lot of info, but we just didn't know what to do about it.
Yeah, this is one of the parts of the platform that I really love. It's not just you go in and you have a bunch of graphs and charts. You have everything here already set in the workflow, like you said. You can focus just on one thing. And I know working in the pharmacy and, in different positions that it is hard to implement a lot of changes or a lot of initiatives at one time. But if
Oh
you
yeah.
have guidance here, if we just want one tech or your lead tech to focus on refill management, if you want a pharmacist to focus on losses, you can really kind of divvy that out within the pharmacy workflow or just choose one thing to get really good at before you
Yeah.
bring on a new endeavor or a new initiative in the pharmacy.
And that's exactly the idea behind it is don't walk in on Monday morning and flip the table over. It never works. Your staff's going to be pretty
Yeah.
pissed off. Trust me, we pissed off many technicians along the way when we were, at our own store.
Yeah.
I mean, we tested this at our own store over the years. And, the one thing we also realize is that on the owner level, what people really like is a synopsis. Give me a breakdown of what I need to jump into first. And so to coincide with this workflow, what we give to every one of our users every single month is a 2 to 3 page, what we call UGO performance report. And that performance report is going to dissect all your dispensing data from last month. We usually divvy them out around the first week of the new month. And it highlights in specifics everything you can do for this coming month to boost profitability, to limit losses, things like that in specific nature, not just in broad strokes. And that has been a monstrous hit across our user base since we rolled it out last year. People really, really, really like being given just, a quick cliff notes on what you're supposed to do. And then you can basically assign to somebody a workflow task or dive into it any way you want to, whatever you feel is the most actionable. We tried to, to give you a silly analogy, we tried to approach this whole thing kind of like a workout routine. If you walk
Yeah.
into the gym and you just have no goals or no plans, it's hard. But if somebody can hand you a workout routine and a meal plan and a whole hoo-ha, it makes the execution of it a little bit more manageable and so on and so forth. So that's kind of what we tried to emulate with UGO.
Perfect. Well, you just said it. I was going to ask what kind of support do you have, but you guys have tons of videos. You do as many one-on-one training,
Yeah.
individualized calls, whatever you need. I know I've done some training with you guys in
Mhm.
that same exact manner, and it was very down to earth, open to questions. What exactly your pharmacy needs. I love that you guys are really geared to that and showing them that information.
Yeah, no, thank you so much. We know that everybody runs their pharmacy different. Everyone runs it their own way. They've got their own, goals they want to achieve, and it's never a one size fits all model. So, we hope to make sure that people have the framework to, achieve great success with the platform, but we also understand that people need hand holding. They need help. And so we want them to have access to us at any point in time. If they come in and request UGO training, they can, request training sessions for owners and management or their technicians and staff. And it, does connect you right to us. And of course, right off the platform, if there's an issue at any time, they can click the help button and they can request immediate help. We'll do our level best to get in touch with them ASAP.
Perfect. All right. Well, I know we already have a large amount of IPC stores that are utilizing URX. I'm happy to see that people are utilizing it and that your community is huge. It's not like, a startup where people think, they get in and want to join in this community and
Right.
there's no information. There's no one in their area or there's nothing to
Right.
pull from. So huge community there. I do look forward to hearing about new users that come on soon, and I'm happy to go over any of these reports as well if any of our members need help. We've looked at quite a few of them now, so we can all work together. If any of our users have any specific questions that you'd like answered, or you would like to sign up for either a brief or a full demo, you're going to find a QR code at the end of this webinar to the UGORx landing page.
Mhm.
And the contact form there will go directly to both of us. I will receive it, AJ will receive it, and team members will reach out as soon as possible to get you set up. AJ, it's been a pleasure as always. I do thank you. Of course, if anyone has any questions, you can reach out to either of us. And I do hope everyone has a fabulous week, and we'll see you next time.
Thank you so much. Appreciate you guys.
Thanks.